was really struck when I was at that conference with you, and people were saying their experiences of awe.
Yes.
How many of them touched on death or very painful issues, not not awe like it was just so fun, but like awe that had a lot of meaning, seemed to be tied up with the death issue for a lot of people.
I think it's very true. It's because the sense of awe, it's a very powerful sensibility. It's, at least for me, it's about both realizing my sense of smallness and fragility in this life, and the overwhelming, or the significance of the specter of death in the background, and the groundless in the background. But at the same time, being able to stay present with that to the point where I was able to come into a realization that I'm a part of all this too. Mm-hmm. I'm not just separate from it, but I'm participating in it. And if I can stay with the process, I come into the more of who I am and what life is about. And in coming into the more of who I am, I recognize, or I'm in touch with the fuller ranges of my experience, from my deepest dreads to my most dazzling desires and fascinations. Mm-hmm. And I think a lot of people kind of relate to that. Awe usually comes from a foundation-shaking experience of some kind.
Mm-hmm. Yeah, it seems really tied up with resilience too, to coming out that other side of it.
Yes.
By having been touched by something that was really, took away a sense of security.
Absolutely. And again, it's that critical point between the possibility to come into the more of one's own being, or the alternative of either total collapse or some tremendous defense against the unknown, the unpredictable. And I think one of the main differences between the two is that with people who are able to come into the awesomeness of the experience more, there's usually somebody there who has helped them. There's what Alice Miller calls a helpful witness. Mm. In my case, it was my analyst to a large extent, although my parents were certainly a part of that too, as they were able. But that intervention is so huge. And that's one of the things I like about your work as well, that you are studying those critical points of intervention.
Mm-hmm. I also thought about it in relation to our returning soldiers, who are a high-risk population, have often experienced a huge amount of stressful experiences, and often very shattering ones.
Yeah. I think, the challenges in those situations are almost overwhelming in many cases. So the degree of intervention needed is of equal intensity, I believe, mm-hmm. For many.
Right, but that person joining with them potentially as a therapist, and them feeling connected could make a huge difference.
Very huge difference. Yeah, I mean, I've had some clients in similar situations, and I believe that the sharing of our own wounding has been an important part of that work, and our own process in dealing with that. Yeah. I I wish that every therapist who at least works in a deep way would have some of the therapeutic experiences I had, which again I would say were life-saving. The one when I was a kid and then a little later on actually in graduate school was very, very important. I always like what my mentor Rollo May said about good therapy, and he said the life is at stake. Person's life is at stake, and good therapy brings that realization out. It's not just rearranging window dressing or dealing with symptoms necessarily, although those are certainly important, but it's going to the core of whether this person's going to be alive in living their life, or the walking dead, or sometimes the actual dead.
Yeah, unfortunately.
Pretty huge stakes. How are students being trained to develop that now? If they're being trained to, perform certain empirically driven approaches or skills, rather than having those skills become more a part of their organic way of living. To me, being a good psychotherapist is about being a good liver. It's a life. It's not just something you do in a cubicle. And that's where its power is mostly.
Yeah. I was thinking about the workshop you did today with that panel about, what are and one of the things that came up is how do we really need to be training students who are becoming therapists, and even maybe selecting differently in terms of graduate studies for people who are more inclined to be able to do that, as opposed to people where that would be more of a struggle.
Yeah, I think this is huge, that students are getting exposed less and less to rich dialogue, philosophical dialogue in mainstream graduate training, to really reflect on what it is they're doing and what their vision of helping is really about. But more important than that is to help people stay present to whatever it is that's coming up for them, even during the training process, to the degree possible, to make spaces for that. And that's why we do a lot of small group work with the students. And it's not role-playing. I mean, we really emphasize using live material and helping the therapist stay with that and work with what comes up in him or her, as well as the client.
Yeah.
I mean, there's no substitute for actually experiencing the challenge, whatever it is, in the moment.